Hi, my name's Nick Thompson. I'm a vet, and the good people at ProDog have asked me to talk to you about what the poo is telling you, how to interpret the stool, and what to do about it. Okay, so the first one, the most easy one, is when you see a reasonable stool, but it's covered with a jelly, a kind of a coating, a mucousy coating. That is a surefire sign of colitis. Okay, and the reason that we normally see colitis is that the dog has eaten a protein which doesn't agree with them. So really you just need to examine what protein the dog had the day before and see if you can tie it up, and then just eliminate that for a number of months. You might be able to reintroduce it. Okay, the next really common one is if the poos are becoming too dry and chalky, and perhaps the dog is a wee bit constipated. And there's a few things you can do. Number one, this is basically because there's either too much bone or not enough kind of fibrous material. So the first thing to do is just reduce the bone content within the food. Okay, talk to your raw food supplier and they will talk you through it. They will have some minces which have a low bone or zero bone content, and you can use that to just dilute the bone content of other meats. Okay, so the other way of doing it is that you can add a bit more fiber, a bit more plant fiber, okay, in order to help the stool come through, and that can be quite useful as well. One of the herbs that we use is called psyllium husk, Psyllium husk. Okay, and it does exactly the same. It's kind of just it's a lubricant, and you can put it into the food, and it helps the stool come out the other end. If every time you feed a certain protein, the stool quality drops, then it's probably because the dog has got a sensitivity to that protein. For example, if every time you feed chicken you get poor stool quality or get a bit of vomiting or something like that, it's just because you've got a sensitivity there. And I would suggest you remove that for that protein for a number of months. You can use probiotics. ProDog, for example, they have a probiotic called Animotics, and that can be quite useful to use. There are other probiotics, but that's the one that ProDog produce. And that's about us. If you see blood in the stool, just one tiny little bit and never again, then keep an eye. If you see significant blood in the stool, then you need to get to the vets. And if any abnormality persists for any length of time, also, I think, get to the vets or have a chat with ProDog. If your dog is sick and looks like they have gut problems, then again, get checked at the vets. Hope that helps.